Childcare scenario, let's start from what was in about 1950s and 1960s. That was a time when the infant mortality rate in India was about close to 150 per thousand. With progress of the country and with progress in the immunization and in the childcare, presently it has come down to nearly about 40 per thousand. I think that's a great improvement. However, if you compare it with the West, if you compare it with the global developed countries, their IMR is much lesser, say about 15 to 20, in between 15 to 20 in the developed countries, and our aim is to reach that ultimately. India, when you talk, there are many Indias between one India. We have an India which lives in villages, we have an India which lives in smaller towns, we have an India which lives in big cities, is affluent, and people who are living in big cities and are not affluent. The provision of availability of healthcare for the children of all these people is different. At one end, we have availability of resources which are equivalent to the best in the world, and at the other end, we have availability of resources which would go back to maybe 30 years from now, which was available then. So there is a great variation, and a lot needs to be done. Very important is for us to bring up those underprivileged places and where the healthcare facility is not there, to at least the basic which should be available to all. So a lot needs to be done, and one of the good examples is a state like Kerala, which has a IMR of say about 19 or less than that. In India, the first thing is literacy, awareness of people, literacy. They have to know that children need regular visits to the hospital, regular checkups. Many parents, I see that child is born, they say, doctor ke paas jaane ki kya zarurat hai? There is no need. So child needs routine visits to monitor the growth and development, for immunization, to see if the child has any underlying ailment which can be picked up early so that we can manage it early. So immunization, very important. In big cities, yes. In big hospitals like this, yes, it is not a problem. But in smaller cities, in villages, in rural, awareness is less. And then a lot of immunizations are provided by the government. Some of them they have to buy, so cost is another issue. Some vaccines are expensive, everybody can't afford. For example, pneumococcal vaccine, rotavirus. Now the government is going to introduce it, but till now it wasn't there. So this is there. Then breastfeeding. Now breastfeeding is something which is reverse. People who are underprivileged and in the rural setup, they actually encourage breastfeeding. In cities, it is going away from people and they are resorting to bottle feeding, which again is a major source of infection of the the oral cavity, of bronchiolitis or gastroenteritis and malformed teeth, dental caries, acute otitis media, and so on and so forth. So one awareness that breastfeeding is best for children and should be advocated to all classes across. Immunization is important to every child, whether it is from the poorest of poor to the richest child in India. Everybody should get the basic immunization. These two things, parents should know when to visit the doctor, even if the child is well, even if the child is accepting well orally, for a routine monitoring of growth and development. Very often we tell our patients, bring your child to the hospital so that he doesn't fall ill, so that he stays healthy. Don't let him fall ill and then come to the hospital. So these are two important things. And third is nutrition. Again, nutrition is related to resources. Resources meaning thereby availability to the parents, how much the parents can afford. Along with availability of resources, again education comes into play. A lot of parents I have seen, they keep on giving only milk to their child for about 1 year. If 1-year-old child comes to me, I ask them, what do you give to your child? Dudh hi pita ji, kuch khata hi nahi, doesn't eat. So then I ask, bottle se pita? Haan ji, bottle se pita hai. Kaun sa pilate ho? Gaay ka pilate ji, आधा पानी मिला के. So the child is malnourished, he is protein energy malnutrition, he is obese because he is bottle fed, he looks white, he has got severe anemia. So we have a protein energy malnutrition, not because of lack of resources, but because of lack of awareness and not ready to follow the doctor. Many times parents come to the doctor gives an advice, give this, the grandparents say, doctor ko kya pata hai, give only milk. So that is the other issue which we face over there. This is a challenge. So we have to call the grandparents to counsel them that what all is actually required for the child, what all is healthy for the child. So these are the common things which we face over here. Just see what Kerala is doing. The most important thing, actually it starts from the day of conception till the child is beyond 1 year of age. Regular antenatal checkups with a gynecologist, good diet for the mother. Again, a lot of social myths have to be weaned off, that mother cannot eat this, that. Good nutrition, follow the gynecologist's advice, and institutional deliveries are actually safe. Once delivered, regular follow-up with the pediatrician, regular immunization, very, very important. Hygiene is a very important aspect which has to be looked into. Parents, literate parents would be hygienic, more hygienic. Again, availability of resources, where they stay, what they do, how they eat, and what they give to the child. So, bottle feeding has to be discouraged at all levels. Bottles were created only for the benefit of parents, not for the children. So, that will do more harm than good. So, institutional deliveries, regular immunizations, regular follow-up with the pediatrician, and diet according to the advice given, like exclusive breastfeeding for 6 months. Beyond 6 months, start semi-solids, continue breastfeeding till the end of 1 year. WHO says even beyond 1 year. It gives a lot of immunity to the child and prevents from many other diseases. So, this has to be encouraged, again across all classes, from the poorest of the poor to the richest of the rich. We keep harping on exclusive breastfeeding. We have seen various kinds of patients coming from one mother who would only want to breastfeed and to a mother who would want to give up breastfeeding as early. We have seen mothers, at the age of 2 months, they'll say, okay, I want to start bottle feeding so that my child gets used to the bottle. Because when I go to work, how will he get used to the bottle? So we have to tell them, you continue breastfeeding. It's only a question of 6 months. Breast milk can be stored in the refrigerator and then rewarmed and given by a Katorian spoon if required, if the mother has to go to work. In connection with this, we had a campaign here at Paras Hospital, which was very successful. That was to provide breastfeeding places in public places. It was appreciated quite a lot. So imagine a mother who has a baby of, say, about 4 months old going to a mall. She wants to breastfeed the child. There has to be a place to breastfeed. She is in a railway station, in an airport. There has to be a place, a privacy, to the mother to be able to breastfeed. This is something which has to be brought in to increase the breastfeeding ability of the mothers, I would say, not awareness. Awareness, everybody is aware. Ability of the mothers to be able to breastfeed anywhere and any place they go in. Even in the places of work, there should be crutches, whether it is school or college or an office, that should be there. And we try, the moment the baby is born over here, we put the baby to the breast of the mother and tell the mother only breast milk for 6 months, only breast milk, everybody. No bottles. But in spite of that, some mothers would introduce bottles somewhere. Then this has to be reinforced whenever they come to the OPD. Generally, whenever they come and I see a bottle, I say, I'll throw it in the dustbin. And then you will be able to breastfeed. And the mother says, a bottle chhodta hi nahi, I just pick up the bottle, throw it in the dustbin. Kal se doodh peene lagega. Child may take less, cry for 1 or 2 days, but then he'll get, necessity is the mother of invention. So you have to be stern, you have to be firm with the mothers at times, things will fall in place. See, as far as general pediatrics is concerned, frankly speaking, for normal cold, running nose, cough, malaria, typhoid, people only from we will go to the nearest pediatricians. However, chronic ailments like a neurological problem or a brain tumor or a pediatric surgical problem, or a chronic ailment like a rheumatic disease or a problem with the joints or VSD, ASD, cardiac problems which may require surgical or routine. For super specialized care, yes, endocrinal problems, for that patients, from far and they intermittently keep coming. But nobody will come for a routine. See, our childcare is a holistic approach. We look at a child as a complete human being. From the day he is born till he keeps on coming to our OPD, we manage children from as preterm as, say, 26 weeks. We have managed babies as low birth weight as 600 grams, salvaged. Intact survival is what we say. Trying to look at all the aspects that the child should survive. He should not have any neurological disabilities. He should not have any problem with the vision. He should not have any problem with hearing. So all aspects are looked into and the child is sent to a normal delivery, to any kind of associated child born with a congenital problem. So all those things we look into. We also look into all kinds of pediatric intensive care. From dengue season, we get all sorts of children, we have, and also encephalitis, meningitis. So there is no point, but a holistic approach. Preventive pediatrics is also what we stress upon over here. So like I told you initially also, I tell my patients, bring your child to the hospital so that it doesn't fall in. So I have patients who come to me with their child. I ask them what happened. No, nothing. The child is fine. We have come for a routine checkup. We take from routine checkup means looking at the growth of the child, the length, the weight, the head circumference, the milestones, the nutrition, and then a little bit of queries from the parents. So this is the Well Baby Clinic. So holistic approach. So it is not that patient comes, okay, what's wrong? We expect parents to come, nothing wrong, we just come like that. So that is something which we also promote, preventive, and that is actually what I feel is the future of medicine. Tomorrow, like we take our car for servicing, we don't go and tell them that my car mein ye kharab hai, we brought for servicing. So even for adults, for children, there is a routine, like between 2 years we say at the time of immunization. After 2 years, the parents ask me, when should we come? After 6 months. Growth has been, so that at any point of time, if we have noted growth has faltered over here, we should get into why this has happened, why the child has fallen below the graph, what needs to be done, what has gone where wrong, rather than child coming at 4 years and we see, okay, he's fallen the graph this way. So that is, apart from the intensive care, which we anyways Paras Hospital does, we also stress upon a holistic approach to the child, and we also warn our parents, the parents of the children, against child getting overweight. That concept is also there, bachcha thoda healthy nahi lag raha hai, the child. So we tell them that healthy is child within the graph. A child going beyond the graph, child obese or overweight, is unhealthy. Unhealthy at this stage will have lots of problems later on in life. So try to keep the child in the median or maybe a little below that. Later on in life, his chances of getting type 2 diabetes or atherosclerosis or IHD or those things would be much lesser. So this concept has also to be put into the minds of the parents. Healthy is not overweight. Future is very bright because people are receptive. Lots and lots of healthcare avenues are coming up in the cities, in smaller towns, in villages. Paras is opening up healthcare avenues in B-class cities. People will become more aware. We have to guide the people. We have to teach the people. Another aspect that goes very importantly along with healthcare and healthcare provision is education and literacy. That is something which also needs to be worked upon. Kerala is 100% literate. They have the best healthcare system in the whole country. You see, whichever state in India has got a poor literacy rate, has got a poor health infrastructure. So that is another aspect which has to come up. Provisioning of healthcare is going to improve in the future, and I think near future is going to be very bright for this country.